Are you seeking effective ways to manage osteoporosis? This comprehensive guide delves into the top 4 supplements that are crucial in the battle against this bone-weakening disease. Stay tuned as we not only reveal these powerful supplements backed by scientific research, but also dive into how they work synergistically to fortify your skeletal system. Whether you're proactively seeking to bolster your bone health or navigating the challenges of osteoporosis, this video is your key to unlocking a world of robust, resilient bones. Let's embark on this journey to uncover the hidden gems in the world of supplements that could be game changers in your fight against osteoporosis. Vitamin K plays a crucial role in bone metabolism. It is essential for the carboxylation of osteocalcin, a protein that helps bind calcium to the bone matrix, thereby enhancing bone strength and structure. Without sufficient vitamin K, osteocalcin remains inactive, and calcium regulation in bone tissue is impaired. Research suggests that adequate vitamin K intake is associated with improved bone density and a reduced risk of fractures. Vitamin K works synergistically with vitamin D and calcium, enhancing their effects on bone health. This synergy is particularly important in the prevention and management of osteoporosis. There are 2 main forms of vitamin K, K1, phylloquinone, and K2, menaquinone. Vitamin K1 is found predominantly in green leafy vegetables, while K2 is found in fermented foods and some animal products. The body can partially convert K1 to K2, which is thought to be more effective in bone health. Vitamin K2 may be absorbed better by the body, and some forms may stay in the blood longer than vitamin K1. For bone health, it is usually recommended to take vitamin K2 as MK7, which is the best form of this vitamin because it stays in the body longer than other forms. So you can potentially take it as a supplement only once a day. The recommended daily intake of vitamin K varies, but ensuring an adequate supply from diet or supplements is important, especially for individuals at risk of osteoporosis. When considering supplementation, it's essential to be aware of potential interactions with medications, particularly anticoagulants like Coumadin or warfarin, as vitamin K plays a key role in blood clotting. Before we continue, please consider subscribing and don't forget to hit the thumbs up button. Magnesium is a vital mineral that plays several critical roles in maintaining bone integrity. It contributes to both the physical structure of bones and the regulation of bone metabolism. About 60% of the body's magnesium is found in the bones, where it influences the crystallization of bone minerals, thereby affecting bone density and strength. Magnesium is essential for the proper utilization of calcium within the body. It helps convert vitamin D into its active form, which in turn promotes calcium absorption. This interplay is crucial. An imbalance in magnesium can lead to diminished vitamin D function and calcium regulation, adversely affecting bone health. Magnesium is abundant in foods such as nuts, seeds, whole grains, and green leafy vegetables. Despite its availability in many foods, magnesium deficiency is relatively common due to factors like poor diet, soil depletion, and increased needs in certain populations. Supplementation can be an effective way to ensure adequate magnesium intake, especially for individuals at risk of osteoporosis. In osteoporosis, magnesium supplementation can help mitigate the progression of bone density loss and may reduce the risk of fractures. It's particularly beneficial in the elderly, who are often at a higher risk of both magnesium deficiency and osteoporosis. The recommended daily allowance, RDA, for magnesium varies by age, sex, and life stage. It's important to adhere to these guidelines to avoid potential side effects associated with oversupplementation, such as gastrointestinal disturbances and kidney dysfunction. Consulting with a healthcare provider is advisable when considering magnesium supplementation, especially for individuals with kidney disease or those taking medications that interact with magnesium. Vitamin D is essential for maintaining proper bone health. It facilitates the absorption of calcium in the intestines, a process critical for maintaining normal calcium and phosphate levels for bone formation and mineralization. Without sufficient vitamin D, bones can become thin, brittle, or misshapen. Vitamin D deficiency can lead to a decrease in bone mineral density, which can contribute to osteoporosis and fractures. In children, severe vitamin D deficiency causes rickets, a condition marked by soft, weak bones. In adults, vitamin D deficiency can lead to osteomalacia, resulting in weak bones and muscular weakness. The body produces vitamin D when the skin is exposed to sunlight. However, many factors can affect UV radiation exposure and vitamin D synthesis, including latitude, season, and sunscreen use. Dietary sources include fatty fish, liver, egg yolks, and fortified foods. Often, supplementation is necessary to achieve adequate vitamin D levels, especially in individuals with limited sun exposure or dietary intake. The recommended daily intake of vitamin D varies by age, but for most adults it's around 600 IU, international units. Again, consult your healthcare provider for personalized advice. Vitamin D and calcium work together to protect your bones. Calcium helps build and maintain bones, while vitamin D helps your body effectively absorb calcium. Thus, both are essential in the prevention and treatment of osteoporosis. Regular monitoring of vitamin D levels is important, especially for those taking supplements, as excessive vitamin D intake can lead to toxicity, potentially causing nausea, vomiting, weakness, and serious complications like kidney damage. Calcium is the most abundant mineral in the human body and is a critical component of bone health. It provides structural strength to bones and teeth, accounting for about 99% of the body's calcium reserves. Beyond its structural role, calcium is also vital in cellular signaling, blood clotting, muscle contraction, and nerve function. In osteoporosis, the density and quality of bone are compromised, leading to an increased risk of fractures. Adequate calcium intake is essential for maintaining bone density and strength. It helps slow down the rate of bone loss and is a fundamental element in any osteoporosis management plan. Dietary sources of calcium include dairy products like milk, cheese, and yogurt, as well as leafy green vegetables, fortified foods, and certain types of fish. When dietary intake is insufficient, calcium supplements can be used to meet the body's requirements. The recommended daily intake of calcium varies across different age groups and genders. For adults, the recommended daily intake of calcium is around 1,000 milligrams, increasing to 1,200 milligrams for women over 50 and men over 70 due to their increased risk for osteoporosis and bone loss. It's important to consult a healthcare provider for personalized recommendations. The choice between different forms of calcium supplements, such as calcium carbonate and calcium citrate, should be based on individual health status, tolerance, and convenience. The two most commonly used calcium products are calcium carbonate and calcium citrate. Calcium carbonate supplements dissolve better in an acid environment, so they should be taken with a meal. Calcium citrate supplements can be taken any time because they do not need acid to dissolve. While supplements are crucial, they should be part of a holistic approach to osteoporosis management, including a balanced diet, regular weight-bearing exercise, and lifestyle modifications like smoking cessation and limiting alcohol intake. It's important to be aware of the potential risks and interactions associated with these supplements. Oversupplementation can lead to adverse effects, and interactions with other medications must be considered.
Thank you for watching, and please click the like button and subscribe.